Hey everyone, welcome back to the Medical Tube. I'm excited to dive into a topic that's super important for expecting parents and anyone curious about pregnancy. Today we're going to break down 10 major causes of breech baby presentation. Before we jump in, if you're new here, hit that subscribe button and click the bell icon so you don't miss out on any future health tips and medical myth busting. Let's start with the uterus, the very home where your baby grows for those 9 months. Sometimes the shape and structure of a uterus can influence how a baby is positioned. Think of it like this. If the baby's room is an unusual shape, it might make it harder for them to get into the ideal head-down position. Conditions like fibroids, which are non-cancerous growths in the uterus, or a uterus that's divided by a wall called a septum, can limit the space a baby has to move around. This can make it more likely for a baby to end up in a breech position. Now imagine having more than one roommate sharing a space. Things can get a little crowded, right? That's similar to what happens with multiple pregnancies. When you're carrying twins, triplets, or more, there's less room for each baby to maneuver into the head-down position. It's like a game of baby Tetris in there. So, it's more common for at least one baby to be breech in multiple pregnancies. We all know that babies born prematurely arrive earlier than expected. But did you know that prematurity and breech presentation often go hand in hand? When a baby is born too early, they might not have had enough time to turn head down. It's like trying to finish a puzzle when you're rushed for time. The pieces might not all fall into place perfectly. That's why babies born before 37 weeks are more likely to be in a breech position. Chapter 4. Placenta previa. The placenta is like the baby's lifeline, providing oxygen and nutrients throughout pregnancy. But sometimes the placenta's location can affect the baby's position. In placenta previa, the placenta partially or completely covers the cervix, which is the opening of the uterus. Imagine a door partially blocked by a piece of furniture. It makes it harder to get through. Similarly, placenta previa can make it difficult for a baby to get into the head-down position, increasing the chances of a breech presentation. Chapter 5. Polyhydramnios. Amniotic fluid is essential for a baby's development, but too much of a good thing can create problems. Polyhydramnios means there's an excess of amniotic fluid surrounding the baby. This extra fluid gives the baby more room to move around, which might sound nice, but it can actually make it harder for them to settle into the head-down position. Think of it like trying to find your way out of a giant swimming pool. You might just keep swimming in circles. Chapter 6. Oligohydramnios. On the flip side, oligohydramnios is a condition where there's not enough amniotic fluid surrounding the baby. Now, you might think that less fluid would make it easier for the baby to turn, but it's actually the opposite. When there's not enough fluid, the baby has less room to move freely and get into the right position. Imagine trying to do a somersault in a cramped closet. It's not going to be easy. Chapter 7. Fetal abnormalities. Sometimes, certain fetal abnormalities can contribute to breech presentation. For example, a baby with a condition called hydrocephalus, where there's excess fluid in the brain, might have a larger head that makes it harder to turn head down. Other conditions, such as anencephaly, where parts of the brain and skull are missing, or certain muscle and skeletal disorders, can also affect the baby's ability to get into the optimal position. If you've had a previous breech birth, you might be wondering if history will repeat itself. While it's not guaranteed, having one breech baby does increase the likelihood of subsequent babies being breech as well. This could be due to underlying factors like the shape of the uterus or other contributing conditions. It's important to discuss your medical history with your doctor to understand your individual risks. As women get older, the muscles and ligaments in the uterus might not be as toned as they once were. Think of it like a rubber band that's been stretched out a bit. It's not as tight and springy. This can make it easier for a baby to move around and harder for them to stay in the head-down position. While maternal age is just one factor among many, it's something to be aware of, especially for women over 35. Sometimes it's simply a matter of size. Just like a big piece of furniture is harder to maneuver in a room, a larger baby might have more difficulty turning head down in the uterus. This is especially true if the mother has a smaller pelvis or if the baby is growing rapidly. Think of it like trying to fit a large suitcase into a small overhead compartment. It might take some extra effort. So there you have it, 10 major causes of breech baby presentation. Remember, if you have any concerns about your pregnancy or your baby's position, it's crucial to talk to your doctor. They can provide personalized guidance and support based on your individual circumstances. For more in-depth information and resources on this topic, be sure to check out the description box below. And as always, thanks for tuning into the Medical Tube. Don't forget to give this video a thumbs up if you found it helpful, and subscribe for more health and wellness content. Until next time, stay healthy and informed.